The government has suspended the shipment of 8 million N95 masks made in China that failed to meet specifications. How big a loss is that for Canada? And given that this was a Montreal company that had outsourced to China, does this not prove that we should not be relying on foreign outsourcing for such critical equipment?
We have been working very, very hard since the very beginning to bring in as much PPE as we possibly can. We've talked about about 23 different flights just from China of millions of items of PPE, because we know the need is and has been so pressing. At the same time, we have ensured that we are ramping up domestic capacity to be able to ensure that we're covering the needs that we have for the longer term. And I want to thank all the companies and manufacturers who've stepped up. At the same time, we also know that in the millions of items that we've received, we have to ensure that they are at the top quality expected by our Canadian healthcare workers. And the withholding or the suspending of shipments from this particular supplier is proof that our system works. We are testing all those masks, all those items before they reach our healthcare workers, because we will not compromise on the safety and protection for our healthcare workers. Right now we're in discussions with the supplier because we will not be burdened with masks that do not fit our stringent requirements. There are discussions ongoing with them about whether there are alternative uses for these masks, but we will not be paying for masks that do not hit the standards that we expect to give to our frontline workers.
I'll just start from the perspective of the agency. We conduct the testing, basically. So that's where we found that a significant proportion of these masks did not meet our standards. So, and just to say that none of them have been distributed for medical use. So that is sort of our key responsibility. And I know that the teams are working on the contracts, of course, and the supplies are looking at this very carefully. I don't personally know what the contractual issue is that someone has cited, but I think you know, our job is to make sure that whatever goes out, it meets a certain standard. And of course, when this much product does not meet standard, you have to go back and look at that arrangement.
Well, I think that's right, Theresa. I think what you've seen publicly is concerns over a number of issues that among other, Mr. Anand has mentioned, which is, you know, in one case, whether the straps were adequate. There's perhaps concerns over the quality of the filtration, whether these masks can be repurposed. You know, when you're working in real time trying to prevent the onset of a pandemic, you make decisions. You make decisions quickly, and the real challenge is to adjust in real time when you recognize that you may not have a source quality that works, and to move on. But as Dr. Tam said, we test vigorously. I think that's something people should be glad for, frankly, as opposed to just deploying them into the public health system and encountering a lot of other headaches. So recognizing that it's very possible, and I'm not part of these discussions. I would direct those questions, frankly, to Minister Anand. So I don't know the contractual terms in between the parties, and I can't speak to that. But recognizing that what Dr. Tam said is that we are testing and we are not deploying things that we believe are unsafe for the purposes that they were purchased for, and that's an important conclusion.